Pocket day. What's going on? Okay, today we're doing IVPs. Okay, so to get started, find your IVP toolkit. It's down here in this drawer. Okay, so talk with me. Actually, let's just set it up right here. Let me show you what you need. Okay, your IVP toolkit requires many things. Alright, to drop your ICU, this is what you need, okay? Your 60 ml, actually they're 50 ml, Luer lock syringes times 2, your 18 gauge needles times 2, your ICU 300, and alcohol wipes, okay? Now, if you're IV trained or certified, then when the IVP comes in, you can place the IV. I'm a one and done kind of guy. If I can't get it on my first try, then I'll call the ninja nurse and have them place the IV for me. But we'll skip that, and I'll just show you how you draw up the contrast, because we're going to do one here in a little bit. Step 1, take off the green lid. Step 2, alcohol wipe the green, the rubber cap. Step 3, open your syringe. Okay. Step 4, connect your needle. Okay. So Luer lock, if you haven't done these before, you just push them on and twist it, and then they stay on. Okay. Next step, pop the cap off, and then this part's fun. You draw 10 of air, and then when you hold this upside down, and you just place the needle right through the middle, push it in. Push the air in, that'll pressurize your bottle so that when you let go, it just starts to autofill. It makes it easier to get started. Don't do more than 10, you might burst your bottle. And then from here, it's just a bit of an awkward grip, and you just have to just muscle it out. So, it takes a minute usually. And the bad part is if you lose your grip or let go, it just starts to push itself back in, so you got to keep pressure on it the whole time. Now as you get further and further along, you want to kind of angle your needle so that you get as much of this out. You're not going to be able to get every last drop. It just doesn't quite work. Okay, so you just get as much as you can. I don't know if you can see this very well. But there it goes. That's about as much as I'm going to get. So then I keep pulling back as I draw the needle out, and that's that. Now, the Intermountain policy for recapping a needle is to do it one-handed, so you don't stab yourself. So you just try to find that, and you're supposed to use like a wall or a hard object here, and then you can recap the needle. And then you just twist to the left, and that pops off, and then you're ready to give the contrast. Now when you give the contrast, you turn the thing upside down, but as soon as I do, it's going to start dripping. And you want that air bubble at the top, and no matter what you do, you can't get that air bubble out. So make sure that stays at the top, and when you push, leave a little bit of contrast in the syringe. Don't push all the way to the air. Does that make sense? Mm-hmm. Yeah. Okay, you do 2 full syringes in the IV. As you're pushing it, you want to talk to your patient, make sure that it's not feeling funky or unpleasant. You look for any extravasation or bubbling, and always before you push, you want to draw back just to make sure you get some blood coming your way. So when you push, you know it's definitely in the vein. And that's your setup.